our veterans, we have a population of over 20 million veterans, and we also have another 9 or 10 million in the military. And that does not always include the families. So we have this huge population in our nation, and only a small percentage actually get their care at the VA. And so they're out there in the community, and it's really important for our community to understand the psyche of these individuals, their needs, the service-connected conditions. There are things as they age that, because of the conditions they experienced from having been deployed, they're aging differently. They have a different chronic condition. So I saw this huge area that I saw was a specialty area of practice, and my research, because I had also been an educator and done research, was all on the military population. So upon my military retirement, it was a natural next step to bring these things together and to say, we need a specialty education to prepare our leaders, our nurses, our physicians, our healthcare professionals who are working with our veterans and with our military members to understand it at a higher level and to really see this as a unique population, to really understand the psyche, the culture, the identity.
I realized when I was over at the VA that just because I was at the VA didn't mean I automatically knew the VA population. And I found myself deficit in that I needed to better understand how veterans had unique challenges and unique healthcare challenges. And so I sought out this program to be a part of it.
Having this specialty area of clinical practice is critically important for these veterans because they deserve, first of all, they deserve the best care. They've served our nation, and they were told that they're going to be cared for, so they deserve the best care. But second of all, they deserve someone who understands their culture and can approach them with that different lens and care for them as a whole person.
I think this specialty is important for our veterans because then they know that they are being treated equally, universally, that no matter whether they go to whatever local community facility, they'll be treated the same way. They'll have, the staff there will have the knowledge, the background, how to deal with these issues that we see daily.
There are so many of our members that are getting care in the community, and I think it's really important for our community providers to have an understanding of the issues that can face veterans, of the types of conditions that they may have based on where they've been deployed, what experience may predispose them to other traumas or other comorbid conditions.
We need to understand that there's differences in veterans and in the military service members. You may be caring for someone who is a service member but in the reserves, and they may be veteran status or they may not be veteran status. But every day in our area in Denver, there are civilians providing for people who they don't even know are veterans. And that's why this education and knowing about this program is so important, to bring to the forefront that these veterans are out there living among us and receiving health care from not just specialty care areas like the VA Healthcare Administration or military healthcare facilities, but they're out there in the civilian healthcare system. And those people the people who take care of them in the civilian healthcare system need to understand that they have a unique life experience.
Coming to the course that I took opened my eyes to the idea of just the military culture and understanding that when you're a civilian. And I think it's just important to understand the literature of some of the top diagnoses that we have and understanding what we're doing and that we are the best who know how to do that really opened my eyes.
Traditionally in nursing, we go through different specialty areas. You learn pediatrics, you learn women's health. And for 10 years, I practiced as a nurse at University Hospital, a very good one, and didn't think much about veterans being some of my patients. I knew I always enjoyed them, but I never thought about unique challenges that they may have faced or strengths that they bring to a hospitalization or a rehab process. So recognizing them as being a unique group and a group that is worth learning about and taking care of has been a powerful addition to my practice.
I think the most profound thing that I've learned from doing this program and working with the students in this program has been how much they've resonated with this content, how much they've seen this as a specialty area of practice, how they've been able to take this information and make their work more meaningful to them, to the patients, to the community, and take it to the next level.
The most humbling and profound experiences have literally been the people in class with me who are willing to share their stories. And sometimes they're stories about their experiences, and sometimes it's a spouse's experience, but they bring such a rich knowledge, both personal and academic and professional. And to have that level of a playing field and that highly qualified students and peers teaching each other is a remarkable experience.
Somebody sent me a text from a patient, and the patient said, who was a veteran, said, I've been through 3 doctors and 3 psychiatrists, and no one has had the level of understanding that you had in helping me with my PTSD. And I mean, that was huge. And the nurse and the veteran both attributed that to the education that she had been able to receive through this program.
I just think it's a privilege that I had the opportunity that I took something like this to open my eyes to really understand how important it is to be educated at a high level of understanding related to the work that I do every day. It's been just a great eye-opener for me, and I'm really grateful that I had the opportunity.
I think the faculty teaching here are amazing, and I think the fact that they are veterans themselves brings with it a richness to this experience. And I guess I would say I feel like this is something that probably should be mandatory in nursing and medicine, that we better understand this group. We have so many people that we care for who are veterans. And I just feel like we're not doing our best work if we don't understand that and the challenges that they have and the strengths that they bring.
This is really a specialty area of practice. And I think that our veterans and our service members can be understood. And when we understand them, when we understand this population, we'll have greater insight into the conditions that affect them, and then how we can serve them, and how we can honor the sacrifice that they've given by taking good care of them.